I had determined that I was going to go down to Stanford or UCSF and not stay here because everyone was telling me I needed the best care possible and I wasn't going to get it here. It's really hard to think about traveling 8 hours to get somewhere. I'm so tired from all the treatments and all the doctor appointments and the disease itself. But I came in and sat down with her, and when I left here, I called my husband on my cell phone and said, I'm not going anywhere. I'm staying right here.
Here is Humboldt County, a rural community on California's northern coast known more for its beauty and outdoor activities than its access to high-level medical care.
You know, Eureka is about 90 miles south of the Oregon-California border, and so we're a very rural area. At one time we had lots of fishing and lots of lumber industries, and now we have very little of that.
We have the redwoods, we have lagoons, rivers, oceans.
When I had treatments and didn't feel good, I was here, I was home. Having that here and knowing that it's as comparable a level of care as you're going to get down there, I don't see the point.
Providing that high-level care is Dr. Ellen Mahoney, the 2017 Frederick K.M. Plessner Memorial Award winner.
When I got here, part of the attitude was, well, we've chosen to not get top-flight medical care because we've chosen to stay in Humboldt County. I said, you know, there's no reason why the standard of care should be any different, say, for someone diagnosed with cancer in Humboldt County as compared to somebody diagnosed with cancer in San Mateo, California. It's simply a matter of making sure that everyone knows what that standard is and setting up the system so that it meets that standard. Some of the finest physicians I've ever worked for are up here. Some of the most challenging clinical problems I've ever seen are up here. And I realized that I was at Stanford for 20 years thinking, well, this is a place where I'll see the great cases. And you realize that in order to see a great case at Stanford, that patient has to have the resources and the time and the energy to get down there. And if they don't, they're here. And we see some amazing clinical problems in some people where, again, social history, which is, I think, the second most important part of the history and physical, really figures into what people will tolerate and how you can help them in their quest for health again.
She's a lifesaver. And she's the most, hope I don't cry, she's the most amazing person I've ever known.
Dr. Mahoney treats her patients like they're her own family.
Ellen was among the first physicians my wife and I met when we moved to Humboldt County. My wife is also a physician. She's an allergist, and Ellen always made us feel very welcome in this new community and always offered to help us get settled in. What really impressed me is that over the years that I've been here, on multiple occasions, she's offered to babysit my kids. I've got 3 kids, and it just floored me that a Stanford-trained surgeon, former faculty at Stanford, would offer to babysit my kids.
Having her as, in my opinion, the best breast cancer surgeon in the United States has been extremely meaningful and comforting to many women.
The thing about it is that she's not just doing surgery, she does these organizations, you know, community organizing for cancer support. She's the head of the cancer program. For a year and a half, she was the medical director of the hospice, and she steps up and takes those challenges. You know, she says she's an undifferentiated STEM doctor. You know, she feels like she can do anything that she puts her mind to. And that is kind of what our rural physician is, you know, is somebody who takes the challenges presented and doesn't shy away from it and just goes whole hog and full steam ahead. She deals now mainly in her clinical practice with breast cancer, which is a very threatening illness. There's so many things that are unique about that, and it strikes at the core of women's self-image, you know, and I mean, obviously I deal with breast cancer patients too, but I'm not as good at it as she is. She had this insight that there were many women who'd had this illness who wanted to give something back and who understood things that hadn't been told to them before. You know, there was all this energy out there, but there was no organizing principle to put it into put it into action. And that became an organization now in Palo Alto called Breast Cancer Connections. One of her patients up here, she came down from this area to see Ellen when she was at Stanford and realized that she could take this concept back up here. And so it just happened to be that we came to this community. It's a completely different organization here, but it's born of the same desire to take the energy of women who've been through a trying experience and come out the other side and want to help other women deal with it.
Dr. Mahoney is a huge foundation of the Breast and GYN Health Project. You know, we're here because of the connection she had to Dr. Julie Animas when Dr. Animas was going through her cancer. But Dr. Mahoney has been a huge part of getting the project started, supporting the project, and 20 years later continues to be a major advocate for us.
She refers essentially every one of her patients to us.
When I moved up here, I didn't know that they had completely formed a project, and that was kind of a kick to see that happen. And they wanted me to get involved there because I thought, wow, Ellen's here now, so why shouldn't she help us out? And I said, you know, I don't want to disturb what you've done. It's too beautiful. I'm just going to sit back and appreciate it, and that's what I've mostly done.
When I think about Dr. Mahoney, I think of her as being passionate about doing the best for her patients. She is a natural leader, and she is an advocate for patients and her colleagues in the endeavor to provide the best care for people in this community.
She really cares about people. She cares about getting good care for her patients here.
You just feel like you could tell her anything. And I think especially in our community, we really require that from our doctors. We want to have a personal relationship, and she gives that to everybody, which is amazing and never seems to run out of energy.
I think it's a great award to go to someone who's really given it all and has been committed to our small community.
It never, ever crossed my mind there'd be a candidate for this award. And as a result, because the process was very cleverly hidden from me, I had no idea it was coming. I was just absolutely flabbergasted, gobsmacked, etc. I almost thought it was a joke when I got called. For a couple of reasons. One was it's always seemed to have gone to primary care doctors, and specialists you know, aren't as visible in this regard. My other thought was, gee, I guess I am a country doctor now, because my identity was so tied up with being, you know, in academia and trying to bring the best of that here. And by the time I finish, I will have spent 20 years in a university that's an academic research center and 20 years in a rural and frontier practice. And I think that's enough time to understand each side of that spectrum and try to bring them together.
I can't believe that you, my dear friend, the real city, big city physician, is now a real, true rural practitioner in the best sense of the word, and I congratulate you.
Congratulations. You so deserve every good thing that comes to you.
Congratulations, Ellen. I love you. I think you're a goddess, and I'm so glad that you're here in this community.
Congratulations, Ellen. You deserve this totally.
It's well deserved, Dr. Mahoney.
Well, I would really say thank you. Thank you for being patient with me through the years.
Thank you for all your many years of service in this community, and congratulations.
Ellen, congratulations. This is an award that's very well deserved and very long in coming. And on behalf of all of us that work with you in the cancer program, thank you for what you do.
What an honor it is to support Dr. Mahoney in the Plessner Award. It's well deserved. Congratulations, Dr. Mahoney.
Thank you and congratulations.
My dear, if there's anyone who deserves it, you have surpassed that.
Ellen, I know that you don't feel like you deserve this award, and I've heard you say it a few times, but I've been with you almost 20 years, and I have seen the impact that you've made with your patients and the difference you've made with your colleagues and in this community, and you certainly, most certainly deserve this award.
I would say, Ellen, you're the most remarkable person I've ever known, and I feel amazed and fortunate that I've been the one to share these times with you and to work together with you and to learn from you. It's been wonderful. I would absolutely do it all again.
I hope it inspires other specialists to be involved in their communities and anybody to look at the way medicine is delivered and see if there aren't things that could be done better. I've tried to make every place I live a little better in terms of the patient's care and make it more of a cooperative effort where I know some things and they know some things, and let's bring all those things together to figure out how we can deal with the problem you have in the best way that makes the most sense for you.